Pregnant women with diabetes mellitus type 1 and type 2. For definition, type 1 diabetes is a condition characterized by high levels of sugar or glucose in the blood. Type 2 diabetes is a condition in which blood sugar levels exceed normal values. High blood sugar levels are caused by the body not using the hormone insulin normally. Next, cause and effects. Diabetes type 1. The beta cells in the pancreas are damaged, resulting in decreased insulin production. As a result, the body cells are unable to take sugar from the blood and blood sugar level rise. Type 1 diabetes occurs due to a disorder called autoimmune, in which the antibodies that are supposed to protect the body against infection actually attack the body's own cells. Diabetes type 2. Insulin can be produced normally, but the body cells are less sensitive, so they can't use it optimally. 6 signs of diabetes mellitus. Number 1. Frequent urination, especially at night. Number 2. Often feel thirsty. Number 3. Often feel hungry. Number 4. Weight loss. Number 5. Usually tired and then blurred vision. Risk factor for type 1 diabetes mellitus. Family history or hereditary factors, namely when a person will have a higher risk of developing type 1 diabetes if there is a family member who has the same diseases, because it is related to certain genes. And then, age factor. This disease is mostly detected in children aged 4 of 7 years. Then in children aged 10 of 14 years. Risk factors for type 2 diabetes mellitus. Point 1. Being overweight or obese. Point 2. High distribution of belly fat. And then a sedentary lifestyle and rarely do activities or exercise. And then treatment. Treatment of type 1 diabetes includes certain hormones to control blood glucose, giving the hormone by injection in the layer under the skin about 3 of 4 times a day according to the dosage recommended by doctor. And then a healthy diet and regular exercise to help control blood glucose levels. Then take care of your feet and have your eyes checked regularly to prevent further complication. Treatment of type 2 diabetes. Avoiding foods high in glucose or high in fat. Increases high fiber foods. Doing exercise regularly at least 3. And then, this is page of diabetes mellitus.
Pregnant woman with miscarriage and heartburn. A miscarriage or spontaneous abortion is an event that results in the loss of a fetus before 20 weeks of pregnancy. It typically happens during the first trimester or first 3 months of the pregnancy. The symptoms of a miscarriage vary depending on your stage of pregnancy. In some cases, it happens so quickly that you may not even know you are pregnant before you miscarry. Here are some the symptoms of a miscarriage: 2. Heavy spotting. 3. Vaginal bleeding. 4. Discharge of tissue or fluid from your vagina. Next, severe abdominal pain or cramping, and mild to severe back pain. In addition to feeling a burning sensation, which can last several minutes to several hours, you may also feel blood, belch a lot, have a sore taste in your mouth, have a sore throat, and cough. Heartburn can fire up, so to speak, at any point in pregnancy, but it's most common during the second and third trimesters. Experts aren't not exactly sure what caused the smoldering, but they suspect it's a three-pronged problem. 1. Hormones. Progesterone, also called the pregnancy hormone, because it nurtures your womb and the baby inside it, is the leading culprit behind pregnancy-related heartburn. Grow baby. As your uterus expands with your grow baby, it competes for space with some of your other organs, like a tube of toothpaste being squeezed. Your growing uterus places pressure on your stomach, making it more likely stomach acid will spit out, especially if your stomach is full. And then slow digestion. Thanks to progesterone, stomach contents stick around longer than normal. As digestion slows and the stomach remains fuller longer and chance of heartburn increase.
I will explain about the repression of production and the immune system. The size of the system that can affect both men and women. This disease is caused by inheritance, genetic disorder, hormonal disorder, and even cancer. Diseases that attack this system have a very signs of causing fertility problems. Then, endocrine disorders are diseases associated with the endocrine glands in the body. The endocrine system is a network of glands that produce hormones which are semi-essential that are released through the bloodstream. Cases of endocrine system disorder. First, the gland produce the most of too little endocrine hormone which is called hormonal imbalance. Second, the formation of lesions such as nodule or tumor in the endocrine system that may or may not affect hormone levels. Symptoms of endocrine system disorder are diabetes, acromegaly, addiction, diabetes, Cushing syndrome, Graves' disease, and others. Then now I want to explain about first aid, midwife kit, and baby dressing pad equipment. What must be for this baby girl? 1. Diapers and accessories, toiletries, medicine spoils, sleeping equipment, hospital distress equipment, baby closet, mother equipment, nursing supplies, Busui-friendly closet, abrasion support, message oil and lotion, healthy snack. Then pregnant woman with placenta, revia, and vaginal disorder. Laurea that occurs in pregnant women is usually the result of acute mental condition of the pregnant woman. This relates to the increased levels of hormone estrogen, so not only psychosis mood swings, but an assault trigger vaginal disorder. Will the vaginal disorder can also be caused by an unstable mode of pregnant woman to thyroid or increase in fluid in misfit. Increased levels of estrogen have also increased blood flow to vagina, thus making the frequency and levels of vaginal disorder increase in the future pregnancy. So, to prevent vaginal disorder, pregnant women should do following: avoid wearing Digs muddy from jeans, leggings, or underpants. Miss P need a smooth air regulation in order to breach cause a fence material that is not tight. Muddy on of a material contact attack on is not safely for under and outside. Keep your vagina clean such as washing, clean, asing, dry tissue after unbathing or defrosting. When pregnant is best not soak in the hot water. Beside the stomach will easily experience contraction. Mushroom can actually develop quickly through hot or warm water. Factors influence in Miss V. Increased levels of estrogen have also increased blood flow to vagina, thus making the frequency and levels of vagina discharge increase in the future pregnancy. So, to prevent vaginal discharge, pregnant women should do following: avoid wearing digs muddy from jeans, leggings, or underpants. Miss P need a smooth air regulation in order to breach cause a fence material that is not tight. Muddy on of a material contact attack on is not safely for under and outside. Keep your vagina clean such as washing, clean, asing, dry tissue after unbathing or defrosting. When pregnant is best not soak in the hot water. Beside the stomach will easily experience contraction. Mushroom can actually develop quickly through hot or warm water.